Hi, and welcome to The Deepest Cut. My name is Sahar Siddiqui. I'm one of the cardiothoracic surgeons here at Mayo Clinic, and it's a great pleasure to have Mesfin Dollar here, one of our cardiothoracic perfusionists, joining us today to tell us a little bit about his story. Mesfin, thank you so much for being here. I know you have an incredible story starting from your childhood that's really led you to being a perfusionist and being at Mayo Clinic, and I just wanted to hear a little bit about how your childhood has influenced you.
Thank you, Dr. Suzuki, for having me. Yes, I am fortunate. I was born and raised in the southern part of Ethiopia in a small village called Shafina to a family of coffee farmers. And I grew up happy as every child, playing soccer and being shepherd and, happy in the village, in a beautiful village. And but sometime when I was in a teenager, I had quite a very my life took a course that unexpectedly I was diagnosed with rheumatic heart disease, and that at the time there's no clinic or hospital or cardiologist who could actually diagnose and see me. But after many hospital visits in the cities around, my family took me to many different hospitals, and I was finally able to get diagnosed. And unfortunately, we didn't have I was in a point of really very, very sick. Yeah, that's me when I was a child.
And you were how old at that point?
I was 13, 12, 13,
yeah.
age, yeah.
So basically, happy childhood, you basically hit your beginning of your teenage years, this devastating diagnosis, but at that time with no real options for treatment, right? How were you able to get the resources and the treatment that you ended up getting?
That's a great question. So I was seen by many, doctors in a capital city, and fortunately, I got to meet one of the internal medicine doctor who finally diagnosed me and knew that I needed actually surgery.
Sure.
And he contacted many organizations outside Ethiopia, and he connected me to one of the organizations in Atlanta, Georgia. And they brought me to Atlanta, Georgia, and I had my first open heart surgery where they repaired my mitral valve.
Amazing.
And I thought everything went very smoothly, and I went back to Ethiopia.
Sure.
Unexpectedly, I had also infection right after I got back to Ethiopia. From wisdom teeth they took out.
Sure.
And they rushed me back to Atlanta again, and I had my second open heart surgery where they replaced my mitral valve, and able to actually met my cardiologist, and who happens to be my father.
Wow.
That's why you see my last name is a Dollar, which is unusual name for Ethiopians.
Yes.
And he adopted me, took me to his family, and I went back to school and able to go to my dream. After feeling better and healed, I was able to go back to school and did what I wanted to do and help others.
It's an amazing story. I mean, just hearing that, obviously there was a lot of twists and turns and setbacks. And so how, as a young person, are you able to overcome some of those challenges when you're going through so much at a young age?
It's one of those things that my family gave me, that hope. I never lost hope. One day I would overcome. I had a faith. I came from the faithful family. We've always, live up to, we can do only, so much, but sometimes life, it takes course in its own ways. But it was a huge challenge for me. There was a time I questions that one day I would just want to, die from it.
Sure.
And, and I wasn't afraid.
Right.
But, God has the reasons for
Yes.
everything. And, my recovery opens door for others, and God had that reason for it. And what I'm doing now
Yes.
as a cardiovascular perfusionist is helping others
Sure.
who had pretty much the same problems here in America, or also in
Sure.
Ethiopia, and I'm involved with that.
So, what drove you to become a perfusionist?
So it's I wanted to be in the medical field. I know from the get-go, but I did not know I'm going to be a perfusionist. But so I did my first, schooling with respiratory therapy.
Okay.
And while I was doing that, I was an ECMO specialist.
Oh, nice.
So I got to shadow perfusionist.
Yeah.
And the very first case I saw was actually mitral valve replacement, exactly on a 16 years old
Wow.
female patient who looked like me. And I was like, from that moment I said, this is exactly what I wanted to do. And I decided then, and I went, through application, and that's how I became perfusionist.
Yeah, that's great to hear. I'm just reminded that like having those early exposures, even like as a student and you're rotating, we get students all the time that come to Mayo and come to our operating rooms, and those interactions can leave such a lasting impression on people. So I think it's like in your story as well. It just sometimes takes one situation to really change the course of your life. So it's very cool to hear. I want to touch upon now, sort of as a full circle. I know, obviously, you're doing well. It looks like you've established yourself here. You've got an excellent profession. You're giving back. How are you now trying to give back to people at home?
That's amazing. That's a great question. You brought it up. I'm actually involved with a few organizations. One is Healing Falls North America, which we fund and help kids under 21 to have open heart surgery.
Okay.
And the other organization that I recently joined and able to actually travel back to Ethiopia.
Amazing.
With a combined mission trip from all over. About 17 medical mission. We went to Ethiopia and did open heart surgeries and all other procedures, and we're able to save about a little over 90 patients.
Wow.
And I'm been very connected. I'm always willing to help others, because I know what it takes and how it feels to be heart disease patient.
Yeah.
And yes, I'm very fortunate, and I'm life circles around, and I'm very connected, well connected with others, and helping others.
That's so great to hear that, like, full circle that you've been able to accomplish. Just thinking about you as a child going through all these struggles, coming here and seeing your success, and then really bringing it back home. That's an amazing story.
Thank you.
Thank you for sharing that today, and I really appreciate your time.
Thank you very much for having me.
Thank you for joining us.